Hi, in this presentation we will discuss about cough and pharmacology of drugs used in cough. Cough is a protective reflex for expulsion of secretion or foreign particles from air passages. Cough occurs because of stimulation of mechanochemoreceptors in throat and stretch receptors in lungs. Drugs for cough: pharyngeal demulcents, including lozenges, syrups, drops containing glycerine or licorice. Second category is expectorants or mucolytics. Under expectorant, two categories: bronchial secretion enhancers like sodium citrate, potassium iodide, guaifenesin, balsam of Tolu, Wasaka, ammonium chloride. And second category is mucolytics. These include bromhexine, ambroxol, acetylcysteine, carbocysteine. Third category of drugs in cough are antitussives or cough suppressants. These include opiates like codeine, folcodeine, ethylmorphine. Non-opiates: noscapine, dextromethorphan, chlorpheniramine. Antihistamines including chlorpheniramine, diphenhydramine, promethazine, and peripherally acting antitussive, including prenoxidine. Next categories: drugs used in adjacent to antitussives. These include bronchodilators like salbutamol, terbutaline. These are beta 2 agonists and these are used in combination whenever there is bronchoconstriction associated with the cough. The first category, pharyngeal demulcents. They smoothen throat, decrease efferent impulses from irritated or inflamed mucosa, provide symptomatic relief. These include lozenges, syrups, and drops containing glycerine or licorice. Second category of drugs in cough are expectorants. Under expectorant, first category is secretion enhancer, bronchial secretion enhancers like sodium citrate and potassium citrate. They increase bronchial secretion by salt action. Potassium iodide can irritate airway mucosa and prolonged use can affect thyroid function. It is no more used nowadays. Next is guaifenesin, balsam of Tolu, Osaka. These are all plant products. They enhance bronchial secretion and mucociliary function. Ammonium chloride acts by reflexly increasing bronchial secretion. Next category of expectorants are mucolytics. They increase secretion, decrease viscosity of mucus, facilitate mucosa removal by coughing. Mucolytics includes bromhexine, which depolymerizes mucopolysaccharide, and dose is 8 mg 3 times a day. Ambroxol, which is bromhexine metabolite, dose is 15 to 30 mg TDS. Acetylcysteine, which opens disulfide bond of mucoprotein in sputum and make it less viscous. It is available as nebulization solution in 200 mg per ml strength. Carbocysteine liquefies thick mucus, but it is contraindicated in peptic ulcer. Dose is 250 to 750 milligram oral. Next category of drugs in cough are antitussive or cough suppressants. Antitussive act on CNS to raise threshold for cough centers or act peripherally in respiratory tract to reduce tussle impulses. They only control cough and they do not eliminate cough. Therefore, they should be used only in dry cough, non-productive dry cough. Under antitussive category or cough suppressant category, first subcategory is category of drugs is opiates, which includes codeine, which is standard antitussive. It suppresses cough for 6 hours, but it is contraindicated in asthmatics, causes respiratory depression, drowsiness, which are main side effects. Dose is 10 to 20 milligram, 6 to 12 hourly. Next drug under opioids is folcodeine, and its antitussive property is equivalent to that of codeine, and there is no addicting property with folcodeine. Ethyl morphine, which is less constipating, produces respiratory depression. Dose is 10 to 30 milligram TDS. Next category category of drugs under antitussives is non-opiates. Under non-opiates, first drug is noscapine. It suppresses cough and antitussive potency is equivalent to that of codeine. It has no narcotic or dependency properties. It is used in spasmodic cough, but it releases histamine and produces bronchoconstriction in asthmatics, therefore contraindicated in asthmatic patients. Dose is 15 to 30 milligram. Next drug under non-opioids is dextromethorphan, which is NMDA receptor antagonist or N-methyl D-aspartate receptor antagonist. There is no constipation with dextromethorphan. Dose is 10 to 20 milligram. Next drug under non-opioid is chlorpheniramine. It has slow onset of action but long duration of action. Dose is 20 to 40 milligram. Next category of drugs under antitussives or cough suppressants is antihistamines. They have sedative and anticholinergic action also. And these drugs, they decrease bronchial secretion via anticholinergic effect. Because of anticholinergic effect, they decrease bronchial secretion. Drugs under antihistamine use in cough are chlorpheniramine. Dose is 2 to 5 milligram. Diphenhydramine. Dose is 15 to 25 milligram. Promethazine. Dose is 15 to 25 milligram. Next category is peripherally acting antitussives. And example or drug under this category is prenoxidine. It acts peripherally. It desensitizes pulmonary stretch receptors and decreases tussle impulses in the lungs. Dose is 100 to 200 milligram, 3 to 4 times. That's all in this presentation. Thank you very much.